currently, in our political landscape, there are actually quite a few levies being discussed in politics right now. One of the big ones are a tax on fattening foods, which, if you look at any kind of fiscal policy, it's supposed to be government intervention that actually assist the individuals of the population. Whereas my opinion here is that a tax on fattening foods would not only be unsuccessful, but actually would be counterintuitive. It would actually harm the good of the citizens of the country. To start, I just wanted to mention that the sources I've used are actually peer-reviewed for the most part. Many of them are actually focused from political journals. A lot of them have doctoral backgrounds, so they're actually very credible sources. And to start off with the tax, so the tax is actually an excise tax, which means a tax on a specific item. So in this case, that is what we're looking at. So there's inputting assumptions that say that price sensitivity would be a factor. So the assumption would be that if something increases in price, you'll consume less of it, which I'm sure everyone understands. That's basically the laws of economics. Now, Dr. Kelly Brown had a statement saying that the health consequences are actually time sensitive. So in other words, you might do something now to harm yourself down the line that you might not think about because it's not happening now, so you don't care. In a sense, you care more about the present than you do the future. So that is one factor that needs to be taken into account with this topic. There's two others. One is externalities. So you doing something that might harm yourself could actually affect someone else. Increased medical costs, any other kind of externalities, something that costs the public that you don't think about, that you think it only affects you, but actually could affect someone else, which also relates into unhealthy consumption of foods. The other one is that there's two primary sources of thought on this topic. So in other words, they think that number one, it might discourage use of unhealthy foods. In other words, you'll switch to a healthier option. And the second thing is, if you choose to still consume it, the tax will actually create a revenue for the government that they can then put towards the externality factor. So in other words, they'll get more money from people who choose to eat these foods still, but they'll put that money into, say, healthcare services that'll actually impact, kind of smooth out the transition. Now, the main issue with this topic, and this is the benchmark for what we're going to talk about today, is the disproportionate consumption of unhealthy foods. The problem isn't that people are consuming unhealthy foods. The problem is that it's the individuals who are consuming them on the most part, which are lower income leveled citizens. Now, this is a problem because they're cheaper. They're just, as a matter of fact, they're cheaper than eating healthy foods. So the price is more desirable than anything else. So if price is desirable, you're going to continue eating them despite any kind of incentive that the government might put your way. Now this, according to Steve Saxon, who actually is an agricultural and resource economist, he says it's nothing more than a regressive tax product. So the lower income people are paying more for their taxes, higher income people who are eating healthy don't pay tax on it. So it's the lower class who can squeeze it in with this tax, not any other, not as a proportion of the total income or total population, it's the lower income. Now there's a substitution of goods effect. Basically, it's an assumption that two things are substitutable. You'll take one or the other. It's not a matter of, in other words, of the same good. Now this is a, we have someone named Veronica Del Ruggi. She's actually the George Mason University. She's an expert on agriculture and on health economics. And she says that basically they're not substitutes. So in other words, if you choose unhealthy foods, it doesn't mean that you're going to choose healthy foods as an alternate. Unhealthy foods is what it is. Healthy foods is what it is. So in other words, price won't make a factor. If price goes up in one, it doesn't mean you switch to the other. You literally will pay more because that's what you want. So it's not going to discourage consumption. Now, there's two questions on this topic. Can individuals substitute when prices change, which is what they want? They want you to change consumption because prices go up. Well, what we found out is that not necessarily. People won't change their consumption because it's not the same good. And you want what you want, you'll pay more for it because it's what you want. The other good isn't the same. Now, the other concept is can individuals reasonably sort when purchasing? So this means, can people say, I choose this food, I'm willing to pay more, and that's just how it is, that's fine, or I don't want to pay that tax, therefore I will purchase healthy food. Is that a possibility? Well, The answer here is no, it's not, because if you're lower income, you have no choice. You're going to purchase the unhealthy foods. If you're higher income, you will purchase the healthy foods. So you don't have a choice. You can't sort yourself where you want to be. You're stuck in an area if you're low income. You're stuck into that unhealthy option with no chance of changing. Now, there's only one country in the world that has attempted to do this tax law, which is Denmark. They're very aggressive in they're very progressive with a lot of their policies. They put in policies for all kinds of different things. Now, this one was the first one to do it. Now, it was abolished within 13 months because they found, according to Ole Linnet Juel, he is the food director at Denmark's Confederation of Industries. According to him, the tax adds 12 cents to a bag of chips, 39 cents to a small package of butter, and 40 cents to the price of a hamburger. And contributed from Karen Kaplan. She is the science and medical editor at the LA Times. The tax kicks in as soon as the saturated fat content of food exceeds 2.3%. Now there's two issues here. The first one is 2.3% is a substantial benchmark, because what will happen is people tend to gravitate towards what they want. Food producers know they can have people paying less money if they get under this threshold of 2.3%. So the first thing industries will look at doing is creating a food that might be way more unhealthy, using chemicals and substitutes to get under that threshold and save their money on taxes to get people consuming their food. So really what you're doing is you're switching from fat content to chemical content. And they concluded that you're unlikely to change habits. As we mentioned, they're not substitutes. And there's little evidence on the tax impacting consumers financially in Denmark, because what happens is they change the consumer behaviors. There's less purchasing locally, there's more imports. So you're going to go to the next country over and purchase because there's no tax there. No one's purchasing locally, it's harming local businesses. Now this is from Clemens Morsdorf, so he's actually on the council in Denmark, so he actually has first-hand knowledge of this. And again, the big challenge you see here is that the big challenge you see is that they're not substitutes. So if you look at a price sensitivity analysis, it would actually take a tax of 67% on a typical hamburger to equal the price of a salad. So in other words, a healthy option, unhealthy. The tax you levy would be so substantial to make them an even playing field, it wouldn't be reasonable. And if it's not exactly an even playing field, all you're doing is you're raising the price of unhealthy food. If it's not up to the price of the healthy food, you still need to consume the unhealthy food, just pay more for it. So that's the main issue, that you need to be over the price of the other food, or else you're just going to pay more without actually changing your behavior. So it's not enough to discourage, and it's also tax revenue, as I mentioned, collected from the lower income individuals, so it's disproportionate. Now, I'll quickly talk about sin taxes. They're levied on cigarettes and alcohol, but the essential thing to notice here is that food is a necessity, whereas these two aren't. So you can live without cigarettes and alcohol, for the most part, but some people need unhealthy foods to survive on. It's a cheaper way of consuming the intake of food you need. So this comparison just isn't appropriate. So to conclude, two primary reasons for the tax are not in line with the results they want. They want to see tax revenue generated from the people willing to pay it, which isn't going to happen. You're going to have lower income people paying that tax. They want to see people get off of unhealthy foods onto healthy foods. It's not going to happen because, unfortunately, people who want unhealthy foods are going to eat unhealthy foods no matter the price, unless that threshold is so significant that it's worth it to them, which it would never happen. It would never get to that point. So solutions, in my opinion, need to come through aid and not through punishment. So they need to come through subsidies for healthy foods. So you need to bring the healthy food down to the price of the unhealthy food for certain individuals based on maybe the poverty line, some kind of threshold like that. So you can't just bump one up. You need to actually even playing field with subsidies, because you're actually then proportionately going after who needs the help, as opposed to punishing those who you think are doing the bad things in society. So, in conclusion, subsidies would be the option I would think would have a more progressive effect, but if this tax law is into effect, then we can see the results aren't going to be in line with what the government thinks they are trying to do. So I want to thank you for your time today. If there's any questions, feel free to throw them out. Anything at all that anyone had?
I have one going back to the disproportionate consumption, and that is simply that sociologists and city planners know that in virtually all of the cities in North America,
Yep.
The lower income districts have the highest percentage of fast food outlets, which we traditionally feel is unhealthy food. Given, where do they want to, or where do they see this going? Because you can't manage where commerce wants to go. And this, you know, the people that own these, the corporations that own these fast food chains, they know that the people will eat the unhealthy food as long as it's cheaper.
Yeah.
So where are the planners that are advocating this tax? How do they reconcile that?
Yeah, so basically what you're saying is that corporations, like you mentioned, they're going to go where they know that the people want that food, and unhealthy foods are going to be in lower income areas, like you mentioned, where the fast food are. Now you're asking city planners, should they be involved to sort of sort that out? Is that kind of what you mean?
Yeah, well, the people who are advocating this tax, like, how do they reconcile that?
Yeah, I think the idea would be to change, because now what we are seeing from some of the studies was that they don't necessarily want to consume unhealthy foods, they're sort of forced into that. So if we can somehow change the incentive so they can afford this food without putting them out any money, without them saying, well, it's going to be more money, if we can make it the same price somehow and let them choose the healthy option if that's what they want, then I think that's the way. But I know what you're saying about the city planners. I mean, literally, where they want the McDonald's is going to be where they think they're going to make the most money. And you're right, it's going to be exactly in those places. So we need to not worry, or at least we need to be in a world where we don't worry about where those are, and we need to worry about who wants to go there. And we need to make them not want to go there. You know what I mean? That would be the ideal world, I suppose. Now, how to do that, that is a huge task, and I don't really know the answer to that, but that would be my answer, is try to get them to not want to go there, even though that's where they're located. That is a huge task, though. That's one that, you know, is definitely